It's been blazing hot lately. Like if you go outside, you melt. I don't know if you guys know, Texas is in kind of a heat wave. I think it was like 106 or something yesterday.
Yeah, there was like a picture of the map, and it was like top hottest places on Earth, and it was like Texas, and then there was like all these other places, and I was like, of course.
Surface of the sun, Dallas, Texas, the desert. So with the summer in full swing, and for all our friends who are watching in places where the sun is very intense, I wanted to talk about some of the negative effects of the sun on the skin. And we talked about skin cancer. This is going to be a little bit deeper.
Yeah, I think we talked about like sunscreen.
Yeah, we were talking about skin cancer. And so skin cancer and the sun do kind of go hand in hand, but I want to take a little bit deeper dive. And I have to thank my wife for this. And the reason I came up with this topic is because the actress Gwyneth Paltrow, who I'm sure you guys have heard her, she posted on Instagram, and she posted this picture of her, and she was at the beach, and like the internet went crazy. Like the comments was all about, oh my gosh, what happened to your skin? So Troubles, throw that picture up, that first one, yeah. And I don't know, it might be hard for you guys to see on the screen back there, but you know what people were looking at was like her skin and how it looks like it's aged, and she's got the dark spots, and she's got like these wrinkles. And so, you know, people are used to seeing Gwyneth Paltrow, you know, in the movies all made up. And so like the internet went wild. And so, and I'm not like trying to harp on Gwyneth Paltrow. I love her. She's a great actress, very successful and all that. But in the picture, there definitely is some signs of sun exposure to her skin. So I want to do a little segment on what exactly are the negative things that the sun does to our skin.
Yeah.
So the first would be premature photoaging. This is related to the ultraviolet light effects on the skin. And I have a little zoom in picture. Can you throw that next one up, Travis, there if you could? Yeah. So you see how her skin, it almost looks kind of dry, almost looks kind of leathery. There's the dark spots. You can notice she's got, you know, got some noticeable wrinkles. These are all kind of classic appearances of photoaging. So, you know, without doubt, if you get a lot of sun exposure, and this is something that you do year after year, it is going to age you. I mean, there is no doubt whatsoever. Some of it is genetic. Some people do have a little bit more protection from that than others, but everyone's going to take some effect. Also, the darker your skin tone is, the more protection you get. So people who are more fair versus more dark-skinned are going to be at bigger risk.
Yeah, so, my skin's always been pretty olivey color.
Yeah, you have a good tone. Yeah, I'm a little bit more pasty than you. So
yeah, she looks like she's deaf. She does not have a top on. Just so we can throw that out there.
She doesn't have a what?
She doesn't have a top on.
She doesn't?
No,
she does.
She's
That's
topless.
A big look.
That is not her bikini. That is the sun. That's her tan.
It's her tan line. You can
she's out there. She's out there sunbathing.
Yeah.
Oh
topless.
my gosh, you're right. I didn't even notice that.
That's probably why she posted the picture to be like, ooh.
Risque. Yeah.
Yeah.
Interesting.
Not.
That's a good pickup.
I look like I have skin cancer.
I assume that white area on her skin was her. Was
no,
a white
that's her tan line.
Oh my gosh, that's why you're here. Point out the things that I missed. All right, next up, actinic keratoses. Okay, so actinic keratoses, and I do have a picture, Travis, if you want to throw that up. These are basically scaly, patchy areas of sun damage that are precancerous. And so I see these come through my office. They can be a little bit worrisome for looking like skin cancers, and to be fair, they are precancers. If they're not dealt with, they can convert into squamous cell cancer. So this is a direct effect of ultraviolet radiation exposure to your skin. Of course, the more you get, the more likely you are to have them. So something you definitely want to watch out for if you are exposed to the sun a lot or have a long history of that. So next is the hyperpigmentation. This is sometimes called sunspots, liver spots, age spots. I got just a random, I mean, we could look at Paltrow again, but these are the same things.
Yeah.
You know, and these are pretty common, in fact. Like I've noticed I got a couple of these on myself. I think my wife's got a couple of them. I mean, this is something you can get pretty early. These are just kind of darkened pigmentations that come up from the sun. It is kind of a sign of aging. And actually, you can get rid of these. Like some of the intense pulse lights can get rid of these. Mm-hmm. And I guess we can talk about the end, some of the things you can do to prevent these things. So next thing is sunburn. We're all familiar with sunburn. It's where you basically get a true burn to your skin. It definitely is worse for your skin to get sunburns. There's a lot of studies out there show that repeated sunburns dramatically increase your risk of skin cancer, including melanoma, which is the really, really bad one. And
the bad one.
That's the one you don't want to get, right? So moving on, skin cancers, and we talked about this like I think a month or two ago when summer was starting to kick off. I have a little picture there that's like the 3 skin cancers that you can see. Basal cell tends to be kind of waxy, flesh-colored nodules. Squamous cell tends to be more like a wound, almost like the actinic keratoses, but worse. The kind of classic thing for squamous cell cancer is a spot on your skin that makes a little wound and scabs up and heals and then repeats that process over and over.
Okay.
And then melanoma is the really bad one. Melanoma looks like a really angry, nasty looking mole that is changing in shape or growing.
Like gross, yeah.
Yeah, so that's the one you definitely want to be super, super cautious about. Fortunately, basal cell and squamous cell very rarely get bad enough to put your life at risk, but melanoma absolutely can kill you. So if you have a mole on your body that's changing, go see a doctor. Next would be skin immune system suppression. So the more exposure, I mean, basically there's things in your skin which reverse damaged cells.
Okay.
And so that would be your immune suppression. When you get a lot of sun exposure, your body's ability, your skin's ability to fix damaged cells starts to dissipate, and that's why skin cancer becomes a risk. And then lastly, as far as one of the bad things the sun does to your skin is called solar elastosis, and I got a picture of that. The skin tends to look kind of yellowy, appears thickened or almost leathery. Once again, there's a lot of kind of crossover between all these different things, but solar elastosis is something that definitely can happen with like repeated sun exposure. People are out in the sun like every day, all day for years and years.
Yeah, that's not cute.
I do like how you put the square over the eye.
Yeah. So actually,
the identity.
I pulled this off a database. So yeah, I didn't do that. It was kind of funny, right? Like it's like they needed to do something so you couldn't identify.
Right.
We'll never figure out who that
Who
is.
is that person? I think that picture's like decades old, honestly. So, also one thing I would like to say is
Yikes.
that smoking exacerbates the effects of sun damage on the skin. And someone actually mentioned on Gwyneth Paltrow's like enormous comment list that, oh, by the way, she used to be a big heavy smoker, and that may have contributed to why her skin looks like that. And they're absolutely right. You know, if you're a smoker and you get sun exposure, it's kind of like the double whammy for having aged skin. And, you know, I have people come into my office sometimes and I can, you know, look at them. I mean, I don't like, you know, give them grief about it, but like in my mind, I'm like, oh, this person, you know, either has had a ton of sun exposure, has been a really heavy smoker, or both. And I can just tell by their skin. So, you know, as far as what to do to protect it, sunblock is the big one. You know, staying out of the sun, using sunblock, keeping hydrated, seeking shade, especially during the really kind of intense sun times, which is, you know, noon to like 4 or 5 o'clock. So yeah, I mean, it's one of those things where when you're young, you don't think about it. You're like, oh, I want to get a nice tan and look good. But it does have its effects over time, and it can really make you look more aged. And as I said, there are things you can do to your skin if it gets like that. I mean, you can zap away dark spots. You can do treatments to kind of reverse those effects. But it's always better if you don't have to do those things.
Yeah, I think I've definitely, back in the day, I would not wear that much sunscreen,
if
at all. But now I'm more cautious about it, for sure.
Yeah, you get smarter.
Especially since I have Avery, and she has a lot fairer skin than I do. I'm like, you know, is it like 2 or 3
2
hours?
That's right. 2 hours, waterproof sunblock.
Yeah, and it's like anything above SPF 30 is what you're supposed to use. Like anything below that's not even really doing that much, really, right?
I mean, I would say that 30 is kind of what you really should aim for, or
I think I have 50 for Avery.
Yeah. Now, I will tell you that if I'm out in the sun and I get like a base tan, like, because the darker your skin is, the more it protects you.
Yeah.
And so as the summer goes on, if I get a little bit of a base tan, I'll kind of go from like using 30 to maybe using 20 or whatever the next step down is.
Yeah.
But yeah, I mean, the main thing is you do want to protect your skin. If you just run out there with no sunscreen on, you're going to get damage, and you're going to end up looking much older than you should when you're not that old. So
yeah, 100%.
Sun's bad for you.
Agreed. But it's also good for you.
The sun's also good. It's such a conundrum.